Thank you and welcome.
Hello.
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 Hello, everyone.
Hi, how are you?
Hello.
Are we all here? Good evening. See Virginia Fields is in the building. In the house. Hi, Christina. Who else do we have
Hi,
here?
Ruben, how are you?
Let me see who else we have here.
We have over 120 participants with us.
All right. Hey. So, Dr. Keck, how are you, Dr. Keck? Are we ready?
We are ready. We are ready for you, sir.
Well, let me just, first of all, to all of those who are directly with us on the Zoom, as well as those who are tuning in and those who will then watch us in the future when we stream this on social media. Happy holidays, Merry Christmas, Happy Kwanzaa, Happy Hanukkah, Feliz Navidad, y un prospero año nuevo. And I hope that all of you and your families are safe at home. I hope that you're healthy. I hope that if you experience some level of ailment, that you're healing and convalescing. I want to just take this opportunity to welcome everybody to this another important conversation that we're having on this virtual Zoom surrounding COVID. You know that COVID has really transformed our thinking, our way of life. It's made us rethink how and when we travel. And by the way, I don't think that anyone should be traveling during this holiday season. That's very difficult not to be with loved ones, especially when they are distant. It has made us reassess and reevaluate how we shared holy days and tradition with our family members. Of course, how we address our own individual health, mental health as well, how we communicate, the fact that now we have to do Zooms. I don't know about you guys, but I've done my fair share of Zooms, too many to mention. I'm sure that all of you have, whether it's at work or even with family members and friends. This is the way that we communicate, how we look and view our employment, how we look at our local economy, and how all of this has really decimated us, especially here in the Bronx. In the Bronx, we've endured a lot of adversity and hardships, you know, everything from job loss to the loss of income. Food insecurity is major. Tomorrow I'll be giving out hundreds and hundreds of bags of food in the northwest part of the Bronx. Anxieties over keeping a roof over your head. So many people now, and I hope that the federal government and the state legislature really deal with how we're going to help those families and folks who, through no fault of their own, are finding it really challenging to pay the rent, to pay the mortgage. Small business owners, especially those in restaurants and the food industry. It's really been challenging. I mean, to put it simple, it's been rough, right, guys? It's been really tough for so many of us, if not all of us. You know, fighting an enemy that we see, that we can't smell, an enemy that could be sitting right next to you at a restaurant or even at a family gathering with this COVID, an enemy that we knew little about back in the spring, that we still finding out more and more as the days continue. We learn lessons of wearing masks, of social distancing, following, you know, safety guidelines, not just to protect ourselves and our loved ones, but we also do it out of respect for each other, our neighbors, our communities, right? You know, a mask is not only about protecting myself, but when I'm in an elevator in my building, I'm also showing my neighbor that I respect them enough to wear that mask. It's become that symbol, you know, and we still have to continue to be diligent. We have to stay focused. We have to stay strong and continue to educate and inform each other. So whether I'm an elected official, whether I'm the borough president or not, whether, you know, somebody hears something, all of us, this information, this type of conversation helps each of us to continue to be educated, not only to separate fact from fiction, but also to disseminate what I think is an avalanche of information. Accurate, even the accurate information is just a deluge on a daily, if not, on an hourly basis, that we have to be able to not only absorb, but then disseminate it. And so how do we do that? And then that's why this is important. We have to continue to test. We're doing testing on a daily basis throughout the city of New York, here in the Bronx. To date, we've done over 1.5 million tests. I've tested myself about a dozen times. We have to continue. Like, for instance, yesterday we did over 14,000 tests in one day. Prior to that, we were under 10,000. But the more that we educate the community, the more that we tell them, not only to educate once, but to continue to do it so that we can track and trace, should there be a positive, we need to continue to do that. And we must support each other. We must support families who are looking for food and shelter. Support each other mentally with those who have lost family members or friends. I've known too many people that we've lost. Our children, we're supposed to be educating our children, with distance learning, but are we addressing many of these kids who lost grandma or grandpa or an aunt and uncle, titi? This is something that we should be supporting them and each other as we deal with this tremendous grief and trauma and loss that we face so much here. In fact, over the last 7 days in the Bronx, we've lost over 30 individuals to COVID. The country, as we all know, has suffered over 300,000 deaths with COVID. But even beyond that, I was hearing the radio earlier today that this year is going to be recorded as the year in the United States with the largest amount of death in aggregate, over 3.2 million. And as a society, we have to deal with that. And then over the last couple of weeks, we see a glimmer of hope, right? We see a glimmer of hope with different companies, Pfizer, Moderna, and so many others that are coming down the pipe with these life-saving vaccines. And it's currently, as we speak, these vaccines are not only, they're being distributed here in the Bronx and throughout the city and the state and other states. Our nursing homes received them yesterday, the Hebrew home and other nursing homes, the faculty there are receiving them, the hospital workers, the nurses, physicians, first responders, everybody's getting these vaccines. And there's so many questions. And let's face it, y'all, the reason why we're doing this, it brings us to this conversation here tonight, because Black and Latinos are very skeptical. Blacks and Latinos lack confidence. Blacks and Latinos have trepidation, and it does not come without merit, because we know historically in the past, and I'll say this, and please don't beat me up if I'm not being politically correct, but we in our communities, we've been treated and used as guinea pigs with experimental medicine in the past. So the reason why I'm so happy and proud, and I want to thank, and I'm going to give me a minute, I want to mention by name, I want to thank my staff, Dr. Keck, and my team for putting this together. I want to thank the New York City Department of Health and Human Services. I want to thank NYC Test and Tracing Team, the leadership of Jacobi Hospital and North Central Bronx Hospital. I see Christina here and others, Acacia Network, Christ Apostolic, did I mention that correctly? Apostolic Church. Did I pronounce that correctly? I want to thank, and by the way, clergy is also a part of this conversation. And of course, the National Black Leadership Commission with this great leader in C. Virginia Fields. You, C. Virginia Fields, with your organization, have really put boots on the ground. You speak with your actions. And each and every single one of you, you're a part of this conversation, and it's needed because you are trusting experts, people in the medical field. You are physicians. You are folks who can speak in layman's terms to our community about these vaccines, the difference in vaccines, when will they become available, Will somebody be totally immune once they get it? Can they still transmit the virus? I mean, the questions are endless. Is it safe for us to do it? Is this something that the Black and Latino community need to be worried about? But ultimately, if we're going to get back to some level of normalcy, we really have to start getting to a herd immunity. And I don't see any other way that you can do that without vaccinating at least 80% of the population. And so what I want is for us to have a fruitful dialogue and discussion and exchange so that, again, we could separate fact from fiction, so that we could depoliticize this conversation on vaccine. And I'm so proud of each and every single one of you for what you've been able to do in your respective fields over the last 9 months. And I'm so thankful that you're with us here tonight. Somebody who, without a doubt, has been a strong voice and advocate to make sure that Black and Latino communities are well taken care of is C. Virginia Fields. Many of you know that I've known her since her days in the city council. She was a Manhattan Borough president. She was a mayoral candidate for the city of New York. And at her young age now, she continues to do God's work more than ever. And so with that said, C. Virginia Fields, with much admiration again, with much respect, I want to welcome you back because we did a virtual town hall not so long ago, and that went over well. We're going to do more in the future. We're going to do them in Spanish and with other communities. But today, we want to address the myths, the facts, and all of the concerns surrounded around these vaccines that my own family members, then some of my staffers question, have concerns, are confused. I want to be able to dispel all of that. And that's why I'm so happy that it brought us here. I've spoken enough. Ladies and gentlemen, please help me welcome none other than C. Virginia Fields.
Thank you. Thank you so much, Mr. Borough President. And you have more than adequately covered the many reasons why we are here and the changes that we had to make in our lives due to this pandemic, and we're still in the midst of that environment. So I want to thank you. I thank your team for working with our office, in my office, the efforts led by my Vice President, Melissa Baker, in working with all of the stakeholders, leaders, and residents of the Bronx. We're just so pleased to be a part of this special town hall tonight on COVID-19 testing and vaccines. Let me just make a few comments in terms of the work that we are doing and why we're so pleased to be here with you in the Bronx, because our organization is working with the Test and Trace program in communities that's funded by the Department of Health and Hospital. And that takes us into all 5 boroughs, where we have people on the ground, like the borough president said, calling it boots on the ground, out there connected with people, talking about what the issues are, distributing masks, giving messages, answering questions. And there are a couple of things that we have learned through all of this. And one, despite the voluminous information that's out there, whether it's on social media, whether it's regular media and so forth, there are so many questions that people still have that they don't know where to go and get tested. And if one has been standing in a line for a very long time, deciding to leave because they don't want to be tested, but not knowing what else to do, been very surprised that the distribution of masks, which are usually in packets of 5, that the distribution of those masks are free, and they are just so happy to receive that, asking questions about other resources, about food and the schools. And what we find is we're out there on one assignment But in all of our work, we know that we have to cover a multitude of issues. And that's what we're finding in this COVID test and trace program. People have questions, they have concerns, and there clearly are fears and concerns, as the borough president said, with respect to vaccines. Do I take it? Do I not take it? What are the truths? What are the myths? So being able to come together tonight and talk specifically a lot about that and the vaccines and where we are, the timing, none of us really know when it's going to hit particular groups that we respectively are in. But what does all of this mean, and how can we get this information out there to our community? So hosting these town halls are going to be important ways in order to communicate this. And this is our first one here in the Bronx, teaming up with the Bronx Borough President. I know that they will be continuing as we move around the rest of the city in the other 4 boroughs to make sure that information is there, dispelling the myths, providing facts, and ultimately people will make up their own minds whether they are going to take the vaccine or not. But I think to the extent that we can provide information based on the science, based on the facts, addressing issues no matter how they come to us or where they come from, answering people questions. That's what's going to get us through. So we have a very, very distinguished panel tonight, panelists who are going to take us through a number of these steps and provide information. So with that, it's my pleasure to turn the mic back over, I think it's to Nancy,
Yes.
in order to get us started so that we can hear from this dynamic panelist. So thank you, Mr. Borough President. Thank you, your team. Thanks to everyone who put this together. And now we're ready to hear from our distinguished panelists.
Thank you very much, Ms. Fields. So we would like to have our panelists introduce themselves and tell us a bit about their organization, their mission, the work that they do in hospitals, communities, and elsewhere. And we would like to start, let's start with Ms. Christina Contreras. Can you tell us?
Hi, everyone. Thank you, Nancy. Thank you, everyone, for inviting me and having me as part of this panelist. Thank you, Ruben Diaz, for putting this together. This is a wonderful forum. I always welcome the opportunity to talk to the community and everyone of all the work that we're doing together. And it's great to see the organizations coming together. This is something that obviously you said it better than anyone. This is something that is impacting everyone worldwide, and it has different implications, and we're all coming together to kind of alleviate and work through this together. So thank you, Nancy. My name obviously is Christina Contreras, and I am the Executive Director for NYC Health and Hospitals North Central Bronx. I'm also the Chief Strategy Officer for Jacobi Hospital and North Central. Our hospitals are part of the health system, the largest public health system in the nation. And I'm very proud to say that our mission is really to care for the community, care for patients, regardless of the ability to pay and provide high quality care. Having said that, we play a very important integral role now, especially with this crisis in particular, because we were in the forefront like everyone else. All the organizations came together. This is historic in the sense that it's something that we never seen. All the health system came together to fight through this crisis, but also leverage a lot of the technology, a lot of the things that we had to adapt because of the limitations that we had, to make sure that we access the community, make sure that we were there for everyone, and make sure that we were able to provide the access for healthcare that everybody needed while we were also addressing the crisis that was happening. Everything was really happening really fast, and it's incredible. Ruben, you said it too. We've been in so many Zooms, and Dr. Niag was here with me, but it was interesting that during the worst part of the pandemic, we were trying And we were trying to reach the community. We felt like very isolated. Even though we were in constant communication with the system, we knew what everybody was doing. And as I don't know if some of you remember, but the guidance kept changing. Every day was something new. Every day, I remember getting a lot of calls from Ruben, a lot of different organizations. We were very, collectively, we were all trying to find out how to add value to the community and how to continue doing what we do. Very fast paced, very, a lot of different changes, but we all adapted really fast. We all had to do what we had to do. And Dr. Aniago and myself make sure that we were, kept the pulse of the community and addressed some of the concerns. A lot of the people felt isolated from the hospitals. Everybody was really afraid of coming to the hospital with, with concerns and reasons. And we were trying to make sure that people felt safe in terms of whether they needed to come to the hospital, as opposed to wanting to be seen or just ask questions. So we tried to stay abreast of everything and make sure that we were giving right information to the community. So, I mean, in a summary, that's basically what we continue to do as a health system. Obviously, everybody knows Jacoby is a trauma center and North Central Bronx is a community hospital. And we all have the same mission and the same vision to make sure that we are adding value to the community and the patients that we serve.
Thank you so much, Ms. Contreras. And next, we would like to hear from Dr. Anyaogu. My pleasure.
I know. Christina has pretty much said it all. My name is Chinyere Anyaogu. Everybody knows me as Chi-Chi. Was born in the Bronx, did my residency at Monty NCB. It's been a long journey, and this is home. So I'm currently the Deputy Chief Medical Officer at North Central Bronx and Jacoby Hospital. During the time of the surge is interesting. Christina and I were like twins. The response and whatever you have to do is always teams. We can't do things as individuals. We're more effective working together, the clinical and the operational, the administrative, and the support system. And, there were a lot of things that came through that we realized and learned as we went. I remember, Ruben, when you came and when the fire department came with the trucks and they were heralding the healthcare workers in front of NCB. It was a much needed support that had to happen. I could see from the faces of the healthcare workers how much they appreciated that. They needed that lift, the pots and pans at 7 o'clock. I mean, it was really heartwarming the way everyone came together. The ability for us to be able to set up and continue with rapid test and tracing within the facility. North Central Bronx was one of the healthcare facilities where the state had designated an increase in the number of beds that would be available for an acute response. And so 2 floors within the hospital was converted to flex surge ICU units to be able to cater for patients if there was a need for the availability of acute care in view of what we had seen during the surge. And so, a lot of motions, a lot of movements. We're really excited about the current therapies and the fact that the vaccine is available to be able to create, I call it a tool in the arsenal against the war against COVID. So we can get back to where we were. And despite the fact that there's a lot of concern and kind of like, kind of hesitancy out there, it's being well received. We've started vaccinating, and I think this is a great forum for us to be able to get more information out there for people to understand what actually it's about and dispel the myths so we can have a more effective outpouring of the initiative.
That's wonderful. Thank you so much. Dr. Collymore, David Collymore from Acacia.
Good evening, all. Thank you to Mr. Borough President. Thank you for putting together this forum, a much needed forum. It's always a pleasure and an honor to be in the same room as Ms. C. Virginia Fields and all of the panelists. It's really a pleasure and an honor to be with you. I have the distinct pleasure of serving as the Chief Medical Officer of the Acacia Network. We're a multifaceted network of affiliated organizations. We have a nursing home, we have senior centers, we have community health centers. We're the largest homeless housing provider for the city of New York. We have affordable housing, supportive housing. We have a large substance use disorder portfolio, including detox and rehab services, residential and outpatient services. So when we first got word of this COVID-19 virus. I remember back in January having a conversation with the medical director of our skilled nursing facility and saying there's something overseas that folks are talking about. We have to start thinking about it because there's a possibility that it might make its way here. This was before we had any cases here in New York. And I remember him saying, you know, we should order some additional N95 masks. And you know, I didn't question him. I said, you know, why not? You know, we hadn't really felt the brunt of it yet, but we knew we had to be prepared. So we stocked up, and our facilities management team has been great in making sure that we've had a stock of masks throughout the pandemic. But that was really just the beginning. You know, at one point, our skilled nursing facility, the majority of residents in there had tested positive for COVID. We deployed additional medical providers to care for them there. We established a testing and isolation protocol that we utilize throughout all of our residential programs. We've been testing throughout New York City. We've been caring for patients without stop in our health centers. So this really has been probably the most dynamic time, I think, of any of our lives. And you know, as Dr. Anyagu said, you know, it's exciting times that we have a vaccine that's available now. And we really need to be on the forefront of making sure that the communities that we serve, the communities that we live in, the communities that we are from have access to this tool that we have to help fight the coronavirus. So it's really been an active and dynamic time, an exciting time, a historic time. It's great to have sort of a light at the end of the tunnel, but the work is not done. You know, we're anticipating an increase in the number of cases post the holiday season. Hospitals are surging. So there's a lot of work that still remains to be done. And I think as Ms. Contreras said, if we work together and collaboratively, we can pull through this and we can look back on this and it can be a memory at some point. But we have to work together. We have to all play our part, all wear our mask, distance, limit our traveling, and we all have to be vaccinated. That really is the key. If we work together, we can pull through this together.
Thank you so much. Dr. Julian Watkins, I would love to hear from you. Welcome.
Hello, I hope you can hear me. Hi, my name is Julian Watkins. I'm a city medical specialist at the New York City Department of Health and Mental Hygiene. Originally, I was working in the Bureau of STI Control, and I was running a clinic up in Upper West Side at the Riverside Clinic. Everything changed up in March when the virus hit, and I've been activated in the health department in various roles and responsibilities. I was an early contact tracer, spoke to one of the first persons who was infected in the community, in the city, way back in March. Worked on the provider access line, helping out medical providers throughout the city. I worked in test and trace. I was the lead equity officer for that project, and now I'm working for the office of the incident commander and the clinical director for the city's overall response. And I just want to, you know, I was just really happy when I was asked to come and to speak a little bit to the people of the Bronx. Just want to remind everyone, like, yes, we're talking about vaccines a lot, but we are in the midst of a second wave. So we're going to talk more about vaccines, but just remember those core 4 things that got us through the first wave, you know, wearing masks, washing your hands, keeping that distance, staying at home when you feel sick, and testing. That testing thing is a newer thing that we didn't have back in the day. And I think that's a really important tool that we have to know your status and know when and when not you can, like, go and visit people safely. So these are the core things that we have. But to speak to the vaccines, I just want to say that, you know, I hear a lot of talk about hesitancy and the distrust. And I definitely understand that it's not necessarily distrust, it is a lack of confidence. Because to be honest, the healthcare community in this country hasn't really proven ourselves or themselves really trustworthy. They've never shown that commitment to do right by our communities. You know, the Latinx community and the Black communities in this country have always kind of been marginalized, which is an active process. People are actively not paying attention to us and not considering us. So I just want to say that your concerns are real. I feel them too. People in my family feel them. I talk to people every day. But what I don't want is I don't want our communities to not be involved in what is a medical marvel. this vaccine being created as fast as it has been, as safely and effectively as it is, that is huge. It's almost like landing on the moon, if you think about what this could imply. So just, try to open up your heart and take that leap of faith as we're trying our best, to make sure that this thing rolls out safely and effectively for folks. And just understand that, your concerns are real and valid, and it's not like you're playing a victim card, because our communities, again, have experienced some real trauma, dealing with the last pandemic and how HIV has played out and continues to play out, thinking about the opiate crisis that our communities went through in the 80s and 90s, and you see how the response is different now. So, I just want to speak to that truth and know that you are not playing a victim card by having some real concerns. But again, don't miss out. This is a major medical advancement, and I just encourage you all to do your research, talk to your trusted medical providers, and enjoy the rest of the panel.
Thank you so much, Julian. Dr. Watkins. All right. The next person we would like to meet is David Anokia. I hope I said your name correctly. Are you with us?
Yes, I'm with you, Nancy. The name is Anokia, but it's pronounced as Anoche.
Anoche.
People used to tell this like last night in Spanish. So David Anoche. Thank you for having me. It's a great honor and a pleasure to be with great people like this in the Bronx. And I am from Christ Apostolic Church, faith-based organization in the Bronx. We typically serve the Ghanaian community. And we've been working with Black Health for some time now through the HIV initiative. So when COVID came in and they asked us to help, we say, why not? Because this has impacted our community and it continues to impact our community. By profession, I am a travel agent. So on the business side of things, I have to shut down because no one is traveling because of the COVID situation. And also my background is with public health, which I had a couple of some years ago, about 10 years ago. So then I need to put my public health hat on to be able to help the community as it were, because business is not happening. If you don't have the individuals with you, you cannot even run business. So we need our families and our communities to stay alive, to be able to help and assist. And also we started with Black Health with the contact tracing program, which we have been actively involved in the community. We use our office space and in front of the office as a place to share masks. We do it on East Tremont Avenue, through Webster, and all the places around the Bronx. And when there is a spike, we also avail ourselves to go to Queens and all the other communities to help, because COVID knows no boundaries. And if you don't tackle it from another angle, it's gonna come to you. So I'm pleased and I'm honored to be part of this conversation. And we'll do our best to also disseminate right information, as I always say, because people trust their leaders. So we as leaders in the community, in the church, in the business, should be able to disseminate information which is right. Because people come to us all the time and ask, is this true? So it means they trust us. So I'll end here and also open the panel to the other people. Thank you.
Thank you so much. And finally, one of the most important people in my professional life, someone that I work with very closely and speak to many, many times a week, sometimes even in a day, is Ms. Anita Reyes, who leads the Department of Health office here in the Bronx.
Thank you, Dr. Keg, and thank you, Borough President and Black Health, for inviting me to be here today. I am the Executive Director of the Bronx Neighborhood Health Action Center, and we've been through a lot of iteration of our name. But this office is the equity-centered office of the New York City Department of Health. And we've been working in the Bronx for about 17 years to address the health disparities, but also all the health inequities. And so we want to promote health equity in underserved communities, and that's our mission. But we're working very closely with the community residents, community partners, and community elected officials to try to address all the issues in our community. And I want to say that currently we're just working on COVID. So we are working on COVID 24 hours a day. And we want to make sure that the community knows that they can contact us. They can look on our website if they need information, because we want to answer everyone's question. So with that, I just want to turn it back to Nancy.
Thank you so much. So as we move into this next phase of our program, we have a number of questions. Some are on the chat.
Dr. Keck,
Yes.
can I just start from, I know we want to get into Q&A, and I want to thank everybody for the overview of your credentials. So we can start with this. I don't know which one of the panelists wants. One of the questions that I get asked is, what is in the vaccine? So a lot of people say, is the virus actually in the vaccine? I don't want to go somewhere where they're going to give me corona. We're trying to fight corona. And now from past vaccines, you're telling me to go to a doctor so they can inject corona in me? I'm not doing that. So what's in the vaccine? Is the coronavirus in the vaccine? And, I mean, I know the answer to this, but I want you to, from the experts. I want people to hear from the experts. And what is mRNA? Somebody. We'll start there.
So, and there are a lot of questions of that in the chat. So I'm going to start a little bit and try to kind of keep it brief. You can get COVID by getting the vaccine, and there's no coronavirus in the vaccine. The vaccine is comprised of messenger RNA and lipid particles that help wrap it so that when it's injected into you by a deep intramuscular injection, that lipid particle will allow it to be able to enter the cell, and the genetic material of the messenger RNA then allows the cell to then perform an immune response. The messenger RNA doesn't last long in the body. Within a few days, at the most a week, it'll be destroyed and removed from your body. So it's an improvement in the technology from prior vaccine development that allows you to be able to have the genetic material that has your body recognize it as a material similar enough to the coronavirus to allow you to mount a response against it. And the response is effective if you get the vaccine. For the Pfizer vaccine, 21 days apart, and the Moderna and AstraZeneca, 28 days apart. And after those two shots, you develop an immune response that is effective in 95% of the people towards having protection against COVID.
So hold on. When we say the lipids and and this and that, come on now. Let's get layman's. You're the physicians here. Somebody explain to the public exactly. So we all see the corona molecule on TV, the one with the little with the spikes. Yes. So again, somebody in layman's term, tell us when you get injected with the vaccine, what does that allow for your body to do in order to detect? And then how does it actually combat that cell, that corona cell, so that you can defeat the virus? Like exactly what happens when it goes down? Somebody, unless you want to give it a shot again.
I can go if you'd like.
Go ahead.
So basically, the easiest way to visualize it, if you think about DNA, you think about the little twisty thing, that looks like a ladder that twists. DNA is like a bigger kind of particle. RNA is even smaller than that. So it's like a smaller piece of the puzzle that we've been able to use and package in this, in these vaccines. So there's nothing in it that can make you be infected, but there's enough there's enough material related to the virus that when your body sees it, your body will mount an immune response. Your body will, see what this is, and your body will make a response. So when you get the second vaccine dose, then your body like doubles down, and then it's like really sure. If the real deal comes in, it's already ready and has all guns blazing, if you will. So it's just it's come out so fast because the technology is so good. And it's not that it was necessarily rushed. It's just they've been really working on this, and the technology is so good that we've gotten to use such little amount of material related to the virus that we can do it right, that we can make huge amounts of doses. We can make it really fast. And you see it's 95% effective. The way that we use flu vaccines, they're not nearly as effective. It's like in the 60%. So this is super effective. and it doesn't cause, and it can't get sick from it. So it's really encouraging. And just to answer, there's a question, we're seeing how long the vaccine protects you. As this thing is, as we're developing it, we're seeing how it works and how effective it is. So these studies are ongoing, and we'll only know more about it. The more people who get it, the better, the better we know about it.
That's great. Thank you, Dr. Watkins. I think the one of the outstanding questions was that lipids are fats. It's just a biological thing for fats, and not everyone knows that. There's lots of questions about what are in vaccines. I'm not sure whether we all are poised to answer that, but there are more medical questions about when, how often. We're getting to those. I see there's a huge amount of questions in the chat. As people come up and speak, feel free to take on questions that you see that are, fall in your wheelhouse. In the meantime, go ahead.
Someone had asked that, he is essentially socially distanced and I'm looking for the question, I can't see it, but socially distanced and lived alone, and why is testing necessary in this time? So we're finding out that a large number of people that actually transmit coronavirus are asymptomatic, and as much as having a 6 foot distance between you, the most of the time, and wearing the mask is protective. We know, you take off your mask to eat. A lot of times people are closer than 6 feet for various reasons. And there has been some communications where people have transmitted the illness being further apart than 6 weeks, as much as they're trying to keep with the guidance. And so for that reason, and to identify, and because asymptomatic spreaders are a huge thing, getting tested helps you to be able to be diagnosed early and quick. So number one, you don't spread it to others. And number two, there are therapies that are actually available, limited, but definitely available, that are helpful for people who are identified soon after their test is positive, who are not sick enough. We know that there are risk groups that are predisposed towards having significant side effects and adverse sequelae to the coronavirus. And especially in those people, you want to make sure that you test. And if you're testing positive, you can prevent spread to other people and get therapies that are indicated sooner rather than later. The testing strategy has helped to be able to separate people who are positive so that they don't go ahead and then further expose and infect others, to limit the spread so that the cycle is broken. So that's why the testing strategy really kind of like outweighs individual attempts to try and do the social distancing and the mask wearing on their own.
That's great. Thank you so much. I have a question here for Dr. Collymore, and that was, in your community-based clinics, because you do so many different services, what is it that your patients are most concerned about? So you are the only member of the panel that really does community-based medicine. Literally, you're at the front door. What can you tell us? We are interested in knowing what are the needs. I know the borough president talked about food and so many other programs that are trying to help with health disparities and with food deserts. And we would like to know specifically, because you have a very broad network, what are the needs in your community on the ground?
Yeah, I think that's a wonderful question. It's a broad question that probably could take me at least an hour to answer.
3 minutes.
Yeah, the concerns and the needs are many. Our community is concerned with their individual health, with the health of their family, the health of their community. They're concerned about the economy. They're concerned about their jobs. They're concerned about getting back to some semblance of life as it was before. And the needs are many. The needs are fiscal. The needs are physical. The needs are mental. Our community has been under a tremendous amount of stress in these past 9 months. And our community has experienced a tremendous amount of loss also. We've lost loved ones, we've lost coworkers, folks have lost jobs. So the concerns and the needs are many. The question was asked earlier about the vaccine, and that is a a significant concern of the communities that we serve at this time. And we should not expect, in terms of the time it took to prepare the vaccine, we should not expect our technology we're almost in 2021, to take the same amount of time that it did, 10, 15, 20 years ago. So we should expect a better result. We should expect a more efficacious product. We should expect it to come to us quicker and be more effective. But the concerns are many. Those are just a small portion of what those concerns might be. But the response really has to be consistent. I think Dr. Watkins spoke to all of the things that we need to do in terms of hand washing, maintaining distance, wearing our masks, frequent testing, and then ultimately the latest arsenal in our toolkit is getting vaccinated.
That's great. Thank you so much. We have a question this one is from Ms. Contreras. A woman named Ms. Barbara Byrne. She says, I'm 80 years old. She's an octogenarian. I'm interested in how vaccination for regular seniors will be carried out. When will it be her term? When will and how will seniors that are not in nursing homes who are healthy actually get the vaccine?
That's a very good question, Nancy. Right now, we're still in phase 1. So we're going through the process of vaccinating. Ruben mentioned that we're trying to prioritize following the guidance of DOH and Greater New York. Basically, the people high risk, which is the essential workers, healthcare workers, and even with that, there's still some guidelines that we have to follow. Phase 2, which should be soon. I believe it's January 1st, right, Chichi? That we're going to be going through the phase of vaccinating the community, and then we'll know the guidance in terms of priorities and the community that we have to be considering, whether age is one of the criteria or other consideration of health considerations. Chichi, you want to add anything to that?
No, you're absolutely right. It's not yet available for the community. The phase is now prioritizing the healthcare workers and those high risk for getting it, as in frontline workers, people who work in the emergency room and the ICUs, and then workers, including the fire department and police officers. It's a very targeted and structured rollout to make sure that for the available doses that the most likely people to be exposed and to get COVID get the initial doses. And as it's more available, then it will be rolled out to the higher risk general population, including the elderly, people who have the illnesses that predispose them towards getting COVID, which includes diabetes, cardiovascular disease, people who are have an elevated BMI, and also those with chronic lung conditions.
I hope that answered the question, Nancy. I think.
Thank you. That's good. There is someone on who contacted us in advance and is also on the chat, and that's a nurse, Ms. Horvath, Annette Horvath, and she had asked for home health workers who do in-home care. They are not, as of yet, considered essential workers, and yet they're in high-risk situations taking care of seniors and disabled people in-home. When and where is a safe place for them to be vaccinated? And that, I guess that should go to our public health, maybe Ms. Reyes?
Sure. So the home health aid are being prioritized, but we just don't know when. It hasn't been set, on stone by when it will be, but we are sure that they are being prioritized.
Okay, that's great. One more.
Dr. Keck, I'm sorry. Just to go back to what Christina was saying before, and Chichi, and those of you who are in the hospitals, right? Mm-hmm. When we speak of the different groups that will be called upon. So, all right, so we have the healthcare physicians, we have the essential workers, so on and so forth. But when it gets to someone with diabetes, or other pre-existing conditions, do those individuals, do they volunteer by going into the hospital and say, I have this condition and I want the vaccine? Or do their physicians call them and say, we know that you've been suffering from XYZ and we advise you to come in if you would like to take the vaccine? Like, who does the identity?
Yeah, how will that do?
I'm sorry?
Yeah, that's actually a very good question. And the guidance for the rollout for the vaccinations is for the vaccination team. And for the hospitals, it's directed by Greater Health Hospitals of New York. And in conjunction with Department of Health, these determinations are being made. The hospital will not be involved in contacting the patients to come in. That'll be done through the Department of Health. And they do have a process that the community clinics and the general public population will be notified and told where they need to go to get their shot. There'll be several areas where people will be able to get vaccinations, not just hospital facilities. And there's a process of build out for vaccination hubs. I think the governor is going to give some more guidance in that in the near future. And so we will stand by and get some more information on how that's going to roll out. A lot of work is being done every day with the vaccination process as we learn, as we get more information on the reactions and responses for those who have been vaccinated. And it's a very steep acceleration and rollout of information. So we should have some more within the next week, because the expectation for phase 2 is to start January 1.
Oh, that's great. Thank you.
This is Virginia. Some of the questions, or rather the responses that you're giving, of course, are very, very informative. And this is the kind of information that I think our community really needs to hear on a fairly regular basis, not wait until we reach the point where something is to be done. I think it was mentioned at January 1st, start in general. Now, most of the time I've been hearing start in general, hit about March or April, etc. So because there's different information at different times, I guess my question would be for our distinguished panelists, what would you suggest, given the roles that you have, of what we must do out there to help kind of stem the fears and the concerns that people have about lots of what we're talking about here and everything else? I mean, these are everyday issues. They're not something that they're going to wait until January to ask or even later. So what advice do you have for people who are out there on the ground?
I mean, I would say this is a very rapidly evolving process. You know, the first vaccine was administered in a hospital last Monday. So we're less than 10 days into the process. Federally qualified health centers, such as our health centers, received vaccine yesterday and started administering today. So we're starting with the priority group of those that are direct healthcare workers. We're moving rapidly and moving rather quickly because we want to get as much vaccine to the community as quickly as possible, so that those that are highest at risk, those that are seniors, those that have chronic medical conditions, those that are living in congregate care settings, those individuals we want to get vaccine to as soon as possible. So we do plan, Acacia does plan to be proactive in reaching out to those individuals. When we get to that point, when supply is at a point where we can do community outreach and call people in, we will be calling in the community to come in. We're planning to extend hours, provide greater access. We want to get the vaccine to the community as quickly as possible. We're rapidly evolving. Day by day, there's new information. We're receiving information and disseminating that to the community as quickly as possible. But I think the best thing that the community can do, individuals in the community, is really to stay informed, stay educated. Question your primary care doctor. Call your doctor and ask for information. Ask trusted individuals in your faith-based organizations. Ask your local federally qualified health centers. What is the latest information regarding the rollout of the vaccine? And we will get it to you as soon.
Someone asked, I feel I need to mention this. Someone asked, do you still need to wear a mask if you get the vaccine? And the answer is yes.
Yes.
That's really important, that people don't feel that once you get the vaccine, that's the magic bullet. It takes time to actually get the antibody response. You have a first shot, and then 3 to 4 weeks later, you have to have another shot. So to actually get that protection you get, it's after your second shot that boosts the immune system to be able to have that effectiveness. And what the vaccine does is it prevents you from getting sick from the virus. The studies that were done for the vaccine were not done to see that you're unable to transmit it to others, even though we're thinking probably that's less likely. And so, you know, until we achieve herd immunity, the expectation is we're going to still need to wear the masks at this time. And so the answer to what do we think we should do, I think this is part of what we should be doing. I think communication is that is effective, is what would be helpful. People reached in different ways. Some people can do webinars and go online and get the information themselves, and some people just want to talk. Since this has started, get my vaccine. You know, people have had a lot of questions, you know, like how did you feel? Did you pass out? Is there allergy? And they need to be reassured because there is a lot of anxiety. There has been a mental health toll. There has been extreme and just an incalculable amount of suffering that has occurred to people who haven't been sick, who've seen or have suffered from what they've lost in earnings, in the ability to work, in the ability to even access their healthcare providers, because we've had to change that over time with very quick and short notice. And so continuing to talk and be accessible, technology has helped us be able to extend ourselves beyond social distancing and beyond the hours of the day. I'm sure everyone has been Zoomed out or WebEx out as much as more so than has been in the past. Before COVID, there were less than 500,000 televisits that have been going on, and currently it's over 1 billion and counting. So using what technology has to offer to help us extend ourselves to different people and being able to address healthcare in the sense of paying attention to the equity issues that would allow us to know what needs to be done to the groups that require a little bit more of a lift to get the information, and distilling it in a way that they're able to appreciate and understand is the lift that we all would have to do.
Thank you, Dr. Niago. If you don't mind, Nancy, I just want to address again, I know Dr. Niago addressed some of the Ms. Fields' question, but I want to add something to that. I do agree communication is the key. We do have to bring the message out there. It's very difficult. Personally, I like to be in the community and I like to talk to people one-on-one. And yes, you're right. We have so many Zooms that we don't know what to do anymore. But there's no other way to substitute communication, kind of reassurance that the people. There's a lot of fear. And I have to tell you, because I hear it, I hear the questions. There's a lot of concern. Sometimes people are afraid to even ask questions. I like how Ruben is bringing some of the questions that are relevant and kind of talking in people's, the way that they understand and they can relate. A lot of people feel comfortable. Dr. Niago, she's right. A lot of our doctors that went first in terms of level priority because they work in the ICU, a lot of the staff, especially nurses, come to them and ask them questions. Even we in healthcare have questions. And that's why we have to realize that this is something that is everybody. It's something new to everyone. We want to make sure that we're confident. We want to make sure we're comfortable. A lot of people are afraid to ask, but we need to reach to them, talk to them, send them messages, how we feel confident. I didn't get the vaccine yet, and it's not because of a matter of choice. I have to wait my turn. I'm not in the priority right now. They're going through the layers, and obviously nurses and doctors that are working with direct patient care go first. The age criteria, we're going by criteria and guidance, and I have to wait my turn. But people ask me, did you get it? I say, not yet, but I'm waiting for my turn and I'll get it. And you have to take 2 minutes to give them a level of confidence that makes a difference. I did ask Dr. Niago, I brought her to Community Board 7 to do a presentation in the health committee. They were static. It helps to bring the message out there. Today we have a surgeon talking. I mean, we trying to do the best we can. I know some people use Instagram, some people use Facebook. Any way possible that you can open real forums so people can ask questions is helpful. This is ideal. I love this because it's different people from the Department of Health, doctors, the administrators, from every field, so we can address concerns. And finally, Ms. Fields, just in terms of access, yes, Dr. Niago was talking to that. We have televisits, we have video visits. We're trying to master, and trust me, at the beginning, these doctors were struggling. is not as easy. And they have challenges because patients are also they want to see the doctors, and they want to, this is what it hurts. And they want the doctors to actually see and feel and kind of like that connection. Most of the times the patients love that connection with the doctor. So we're trying to do the best we can and taking that opportunity to educate them as well in terms of choices and what they should do.
If I could chime in a second for those, I'm sorry, Anita, you wanted to go in? Okay. In terms of when some of us get the actual vaccine, that's a catch-22 because you want people that folks can see that they can trust, right? So for instance, when you see that the president-elect is getting it and members of Congress, a lot of people say, well, why should they get it if they're not, if they're not, seniors or if they don't have, but that's to show the public that if they're willing to do it, that the vaccine is safe and it's effective.
Absolutely.
At the same time, what we don't want is for people to think that they could jump the line. So some of the people who are wealthy are better off. And this is why we want to educate. And so let me just focus it back on Black and Latinos for 1 second. For those of you who have studied the trials, the results of the trials, do we know how many minorities were a part of that? So I know that Pfizer and Moderna, when they do trials, some people get the vaccine, some people get a placebo. They've done 40,000 plus trials. That's why we know it's 95% effective. But of the people that were participating in the trials, how many of them were Black and Latinos? How many of them look like us? And what was the results? So if it's 95% effective, does that mean that the 5%, was that all minorities? Does anybody know the breakdown of this? Just so that we can put out there to folks that it's okay for Black and Latinos to get the vaccine because Blacks and Latinos were also part of the trials and everything turned out to be okay. I don't know if I made sense there, but.
I could speak a little bit. I'll say we were unfortunately underrepresented in the Pfizer trial for sure. I haven't seen the exact the demographic breakdown for the Moderna, but, I think it kind of speaks to that distrust. Like a lot of people were resistant to even enroll in the trials. And so luckily, luckily we're all part of the human race, and there's not a lot of genetic difference between people of different races. There's a lot of other external factors that do contribute to people having bad and worse health outcomes. But luckily we know that is for sure that genetically we're more the same than we aren't. But I would say now more than ever, now we're going to actually see, as this thing spreads, we'll have more, we'll learn as it goes. And we see more people of color getting it. We'll see more how more people are responding to the vaccine. And so again, because this is a monumental effort that nothing like this has been done before, we're kind of learning as we go, but understanding that the science is sound and that, we're doing the best that we can for safety. And the trials that we've had so far have been overwhelmingly safe. And speaking to special populations, for people living with HIV, I would say, especially if you're on medication and you're controlled, there's no reason to believe that someone living with HIV would be at any increased risk, especially in the age of U equals U, undetectable equals untransmittable. Essentially, your immune system is like that of someone who's not living with HIV. And so, so I think it's definitely safe for someone living with HIV if you meet the qualification. And for other communities that are at higher risk, like people who live in congregate settings, like prisons, people who live in nursing homes and stuff, there's a whole breakdown of prioritization because a lot of the people who can't distance physically by the nature of people who are currently not who currently don't have homes, who have to go to shelters. If you can't distance, these are the people who all of this equity work and advocacy that's been done on the public health side is to make sure that those people have access to these life-saving vaccines sooner than later.
And I think that one of the questions, I'd rather go into Julian's point about, and I think the Borough person asked, the percentage Blacks and Latinx who were a part of it. Now, one of the things that I guess I heard or been reading that perhaps Moderna had 10%, and that Pfizer's was even less. But what Julian said and I'm not a medical person, but obviously read all this stuff too. What Julian said is that we're kind of doing that third phase now with Pfizer as more African Americans and Latinx people take the vaccine. That is proven, I guess, at somewhat the results or the outcome. So I guess you would say somewhat is trial and error. But my point in all of this is that when we talk with people, maybe that's a question we should get some specific responses from the pharmaceuticals who have put this together. So when we speak, we're speaking not just, maybe from what we read or what we heard, because I know there's been a lot of discussion around that specific point. And I'm also glad, Julian, you spoke to the HIV, because a number of questions have come up in the chat about that. And since that's an area that I know the Borough President's office and my office have worked on with respect to people living with AIDS, that to be able to work with the population and answer those questions. And a question came up about people in shelters. Where do they fall in terms of the priority? Does anybody know? Homeless shelters?
I know they're higher than the general public just because people living in shelters, it's a congregate setting, like multiple people are living in closed space. So yes, it's going to be higher up. I can't speak to which, 1B, 2B, I don't know which exactly, but it's a higher priority for sure.
Yeah, people who live in shelters, any communal setting where there's a large gathering is prioritized to go within this first group. So shelters and residential nursing home residents are also within the earlier vaccinating group.
And I think one thing that's incumbent upon us also, certainly as elected leaders and community representatives, is to follow up to make sure as the vaccines are distributed to, say, nursing homes in our communities and or shelters, to follow up and make sure that it's there, that the vaccines are in fact there, and some sense of who's actually being vaccinated, because some reports are that seniors in or people in nursing homes don't want to be vaccinated. So I think that will help us to understand better what's happening in our community. Where are the nursing homes? How many of them or which ones have actually received the vaccine? How many people there, the workers as well as the patients, have been vaccinated? That will help us in our own communities about understanding what is or is not going on.
I want to add the fact that we need to use the faith-based community very well, because these are individuals, pastors, elders that the congregation trust. So they should be a huge part of the information being sent out there. Because I believe people of faith believe they are pastors, and whenever their pastor says something, they actually are more in tune than getting the information outside. So if proactively they were able to inform the pastors, partner with them as stakeholders in this, so that they can send the information out there. And when it comes to the business community, we also have to target people where people engage people, like especially my barber shop. If I go to my barbershop, there's a whole slew of discussions that centers around the whole things that we talked about during the haircut or salon parlor. So these are areas we also have to go and also inform them so that they can also inform the people. And coming back to the pastors are the head and the elders will be in the middle. So it'll be like a tripod kind of dissemination of information. Once this information trickles down, they can also inform their family members so to speak. Thank you.
Before the next question, I just want to say regretfully that I have to get off and get on another Zoom. So to all of you, see Virginia Fields, to all of you, thank you. Happy holidays again. Stay safe, and I'll see you all soon, okay? And
thank you, Mr. Borough President.
Thank you.
And I'm following you, not on the same Zoom, but I also have to leave and was about to say that. And I thank you so much. I thank everyone. Happy holidays, and we all look forward to a brighter and healthier new year.
Absolutely. God bless all. Thank you.
Thank you.
Now, relative to the question regarding the clinical trials, I think, historically, communities of color have been underrepresented in clinical trials. So it's not surprising that the numbers were so low in these studies. But what we do know is that our communities of color were ravaged by the coronavirus at disproportionate amounts. The Bronx in and of itself had a higher mortality rate than anywhere else in the city. So we do know the impact that the coronavirus had on our communities. And because of that, it's all the more important that we encourage individuals within these same communities that suffered so much that they do protect themselves and protect the community through getting vaccinated. And to Dr. David Anochia's point about utilizing faith-based organizations, I myself am the son of a pastor. I'm an ordained minister also. I know that folks in the church probably trust me more than my patients trust me. So I agree wholeheartedly with working with faith-based organizations on a number of different fronts, including COVID-19. And then communication, as you stated, is key in so many different venues and forums within the healthcare environment, but also outside of it, where many of our patients and residents in the community go to.
Thank you, Dr. Collymore. I would like one of the other physicians to address a question about the fact that there are different types of COVID tests: antibody, antigen, self, rapid. People are interested and want to know, since they're being asked to test often, how often is safe and necessary, especially for seniors? And also, what's the merits, what information do you get from the various kinds of tests? So who wants
I can speak to that, but I know Anita was about to say something. If you want to unmute real quick before I respond.
Sure, I was just going to say that communication is important, but it has to be from reliable sources. So the best way that you can get information is going to the website, the Department of Health's website, but the city is going to do a big effort in terms of working together with elected officials, working with community boards, faith-based leaders, community organizations, and we're going to have print ads as well as other communication out there for the community to know when the vaccine becomes available. So I think that's very important in terms of how we're disseminating information. Thank you.
Thank you.
And I'll just, for testing, so the recommendation in general is once a month testing. You should get tested more frequently if you are around more people, or if your work requires you to be around more people more frequently. You can test more often. There's 3 major types of coronavirus testing. The most traditional one and the one that's been around the longest, and the one that's the most sensitive and specific. That is the PCR test. That's the swab that used to go really, really high up. Now they can kind of get not so high up in some sites. That's the most definitive, sensitive and specific. That's like the number one. And then you have the antigen testing, which can be also like sent off to the lab, but that's like that rapid test. That's the antigen test. And they can test various different sites. Sometimes it's just like in the tip of your nose. There's a few other ways that you can test it. And some of the home testing kits are going to be using that antigen testing. Then the third test is the antibody testing, which is a blood test, which doesn't check for active infection. Those other 2 check for active infection. The antigen test is the antibody test is testing if your body if you've been exposed to it or have been infected in the past to the virus. And so there's speaking with your medical professional, there's a combination of testing strategies, but I would say definitely if you're confused about it, talk to some medical professional, or I would just recommend getting at least the PCR test at any of the city sites. All the city sites are free, be them at the DOHMH sites. There's a one DOHMH site at Morrisania in the Bronx, and there's a few of the H&H facilities, which I'm sure someone else can speak to those locations. But also considering some of the rapid testing options too. Just to note, rapid testing, if you're symptomatic, you know, there's better ways, but I would say the PCR is the gold standard, but the rapid is for good if you're screening, if you're feeling okay. If you're like not feeling anything, you just want to get low risk, no concern for infection. You can do the
rapid test. And I just want to add that if you do the rapid test and it's negative, there's still a possibility that you could have COVID, and you may need to have the PCR test. So it's really important that you understand which kind of test you're getting, so that you're properly kind of triaged and or have the proper guidance, so you're not having a false sense of security. If the PCR test is positive, then it's highly likely you do have COVID. If it's negative, it's likely you don't. However, if it's negative and you have certain symptoms, it's possible that you still actually have COVID and you had a falsely negative test. None of the tests are 100%. And so we want to kind of make sure there's if you're concerned or if you have exposure, that you get tested and then repeat tested, so that you can make sure that you're actually negative and or positive. People have said that they've had negative tests and then tested shortly later positive, and that's one of the reasons why.
That's great. Thank you so much. Before the BP left, I'm sorry he didn't get to see his map. I wanted to show this to everyone because, as Anita mentioned, we are very much evidence-based in the Borough President's office. We start each day looking online. We look at our own zip codes. We look at all the places that we know where there have been hotspots and where the rates have been high. I mean, over the summer, we were down in the 2 and 3%. This is from the New York City Department of Health COVID tracker page. They have a series of different tools, and one of these is when you go online, I've entered the zip codes, but you basically hover your mouse over each one of these, and it gives you lots of really interesting and important current data. So the reason I mention that is because we use that information. We have a shout out to Laura Atlas of Test and Trace from Health and Hospitals, because when there is a hotspot, and as you can see now, we have 2 of them on the east and on the west coast of the Bronx that are over 9%. 10464, about 11 days ago, a little bit more, was at 12.8%, the highest rate in the entire city, even higher than in South Brooklyn and in Staten Island. And what we did was kind of a new thing. We got resources from New York City Department of Health and from New York State, and we had Test and Trace come and send our mobile vans in the pouring rain and snow, and they spent the whole weekend there, 2 weekends in a row. There were also our local community board, our local councilman in that zip code, and also 2 not-for-profits all showed up. They all descended at once. And we gave out masks, we gave out information. There were community health workers that actually gave out all kinds of DOH pamphlets and guidance, and spoke to people about the testing and about how to, get into the portals. It was complex, but it was great because the rates really fell significantly. And then now, after our second weekend of testing, we're back up to 9% because we're still within that 2-week window. And many individuals have been sent in quarantine in this community, but it was a good way for us to see what were some of the glitches of how to do this on the ground through the mobile vans, and using all of the resources from all the agencies, public, private, and otherwise, in order to get out a big community effort. Lots of people came from all of your agencies, and I want to say thank you for that. Before we go, if there are any more, thank you, Melissa, we can get rid of that. And if we can see if there are any more questions in the chat, our time is running. It seems like we have 4 minutes left, and we still have some really fascinating questions that are here. If anyone is willing to answer some of them, I can only see the last one that has something interesting about what's in the vaccine. There's a lot of not accurate information about that, but
there's no liquid chip. There's been a lot of talk and chatter about a liquid chip, a metal chip, a sign of the devil, the satanic verses, lots of different things. I will admit that this took, like rocket speed. And in our lifetime, we've never seen technology to be accelerated to this degree. And a lot of different things that came together. Basically, the world came together to have enough people who were trialed and tested, to have covered the cost of the risk involved in developing a vaccine and having a new pharmaceutical being developed, not having to worry about costs because it was footed by the government. And then also the fact that technology has changed over the last decades to be able to have us utilize messenger RNA within a vaccine, which is different from normal vaccine production in the past. Not bad at all, actually all good. And it's a progress in science that has allowed us to be able to have these opportunities and these options available within a year. So I think that as much as it's unusual, nothing about COVID has been usual. Nothing has been anything we've seen before. And so we have the data, though, we have pretty robust scientific information that helps us to see that this is something that is worthwhile and is a definite positive intervention that would help in the war against COVID.
Can I add just one more piece? In terms of disseminating information, what I will encourage everybody to do is that we have our own orbit with WhatsApp and how people disseminate bad information. I mean, if somebody sends out bad information, it's only one person. One person can stop that person. Because people like to forward misinformation all the places. They pick up their phone, they have like 200 people on their WhatsApp, they send misinformation. So if you can take it upon yourself as an individual to just stop it there. If you don't know the source of information, don't send it out because it confuses everything. And one person can stop one event and it can save so many lives. Thank you.
Thank you very much.
Agreed. Yeah. I'll just say a lot of times people call a doctor they see on TV or they heard someone from somewhere. If you don't know who that person is and what their credentials are, don't just take it just because someone said it, because again, like this is a medical miracle, that we have gotten this far and this advanced with something this effective, and I would hate to see our communities miss out on something that could save so many lives. If you think about vaccines in general, how many billions of lives have been saved. Vaccines have cured polio in the African continent, cleared polio from the United States. Vaccines were what got rid of measles for a while, and then it came back because people weren't vaccinating. So, it saved lives. So I just say, there is a leap of faith, and I want to acknowledge it, but really consider it and just understand that this is something that can really save a lot of lives.
Thank you so much. I want to remind everyone that there are resources from the Department of Health, as Dr. Watkins has already put in the chat. Frequently asked questions about testing. There's also from the CDC, a frequently asked questions about vaccinations. There is really, really good data and resources that you can access by looking to your departments of health, whether it's state, whether it's city, or whether you're looking and make a phone call, to your local neighborhood health bureau, as in, reaching Miss Anita Reyes. She always takes calls. She always answers questions. We get them as well in the Borough President's office from people who don't know social media, don't use computers, and like to use the phone. A lot of seniors call us that way. So thank you so much. I want to—
Nancy, before we close out, I just want to make it known that we've been going on Facebook Live, and so it will also be available via recording. So those of you that are participating will get a link when it's available, because there's been a lot of great information and just going through. First of all, just thank all of you for monitoring the chat as well. You did a great job, and I'm sure there's a lot of information. People will want to go back and play it over and over again, as well as shares with the community. But we thank you so much for participating. This has been amazing. Very good information, but very well spoken in a way that people understand it. I think that's what's important.
Thank you. We have one last round question for everybody, and that question was, are you going to take the vaccine when it comes your turn, or whether
Took it already. I already got it.
I'm waiting for my turn.
Most definitely when it's my
As soon as I can.
as soon as possible.
I got my
Definitely.
vaccine on today, so just a few hours ago. Feel great, and looking forward to administering it to as many patients as possible.
That is great. I'm happy to hear that. I joined the vaccine trial, so I don't know if I got the real thing or the placebo, but I got very sick for 2 days afterwards, and then I was fine. You know, if that's what it takes, then that's okay too. Thank you so much.
Yeah.
All of you.
Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you so much to our participants. Thank you so
Thank you,
much.
Ms. Baker. Thank you, everyone.
You're
Thank you,
welcome.
panelists.